Hello, my name is Jillian Johnson. I'm a sophomore public health science major, and I have been a part of the Global Public Health Scholars Program here. So for my practicum, I decided to focus on making medication understandable and accessible working as a pharmacy technician. About a year ago, I became a licensed pharmacy technician by the Maryland Board of Pharmacy. My day-to-day work includes filling prescriptions, communicating with patients, doctors, and insurance companies, and just helping make medications accessible through affordability and convenience for the patient. I decided to start this journey about a year ago as I was inspired by my cousins, Brian and Erica. They suffer from cystic fibrosis, but they're living with it. They have an extensive medication regimen that has helped their lung function so much. And I've just been so impressed with how well they stick to their medication regimen. It's a lot of different pills to balance, but when you keep it organized, it really has a huge effect on their health. And it's because of the support system that they've had from their family growing up and their knowledge about their medications that they can take them responsibly and the medications can be as effective as possible. And I realize not everyone has that kind of support system and knowledge, so that's why I wanted to work at my CVS pharmacy in Newmarket, Maryland, so I could try to be part of that support system for the community. CVS's mission is simple. It's to help people on their path to better health. I worked in a retail pharmacy with drive-through accessibility, which was extremely helpful for people with limited mobility to still have access to their medications. And on a day-to-day basis, we typically had one pharmacist on staff with 2 to 4 pharmacy technicians. As for public health implications, I focus really on 2 things: making medication affordable and making it understandable for responsible usage. So we have to start with making it affordable. This graphic here from Kaiser shows that 29% of people have said they did not take their prescription medication as directed because of the high cost. It's unfortunate when patients come in and they can't afford their medication, but luckily there are resources like manufacturer coupons, GoodRx coupons, changing around the day's supply of the medications, or trying out some generics that can make the medication affordable. Along with that, there is the side where patients don't always understand what they're taking. Sometimes a patient will show up to the pharmacy and not know what they're picking up or how it's going to affect them. So I like to educate the patient on both things: how they can keep it affordable as possible, as well as understanding what the medication is going to do for them and how they can take it to get the most out of the medication's benefits. When people don't take medications as they should, we see higher rates of illness in the community, and it's important that we have these pharmaceutical advancements. They're here, it's 2020, so let's use them as responsibly as we can to get the most out of them. So the challenges I faced, like I said, were patients coming to the pharmacy and not being able to afford their medication. Unfortunately, sometimes doctors do prescribe medications and they aren't aware that the patient either doesn't have insurance or has a limited insurance plan. So the patient shows up to the pharmacy to pick up their prescription, and it turns out it's way too expensive and it's something that they cannot afford. We then have to reach out to the doctor and try to get them something else, but oftentimes that limits when they can start their treatment. Also, the CVS in Newmarket was so busy and we treat so many patients that it was difficult to find time for every patient to make sure that we can really explain to them how their medication works and send them home understanding what they're going to be taking. But the major takeaways I did learn is that there's a lack of communication, as I said, between the patients, the pharmacists, the doctors, and the insurance companies. Sometimes the patient comes to the pharmacy, they don't know what they're picking up, and they don't know that their insurance isn't going to cover it. And if we all had communicated better, we could create a regimen for that patient that's affordable, something that they understand and that they're going to stick with. I also found that it was really great to check on patients every once in a while, either a call or seeing them stop by in the store, to make them feel valued and inspire them to make their health a priority, because we make their health a priority. At CVS, we do something called patient care calls, and around, let's say a patient picked up a 1-month prescription. Around 25 days later, we give the patient a call and we check up on how they're doing on the medication, see if it's helping them, and we say, it looks like you should be running out soon. Can we get that ready for you in the next few days? And more often than you would think, people say, oh, well, I still have plenty left. You don't need to get it ready for me for a while. When realistically, they shouldn't have much left, and that either means that they've been skipping doses because they're trying to make the medication last longer because of its price, or because they simply didn't understand the direction and how often they should be taking the medication. So I found that those patient care calls were extremely helpful in keeping the community educated on their medication and how it can help them reach their health goals. So I thought CVS handled these situations really well, but if I could advise some improvements, I would just say an improved system of communication to keep everyone in the loop, as well as more research in the pharmaceutical field to make more generic medications, ways to synthesize the medications needed in a less expensive way so patients can afford their medication and reach the health goal that they wish. And this job overall really solidified my goal of becoming a clinical pharmacist in my future. I want to be that pharmacist who works with the doctors, the patients, and the insurance companies to get that patient their medication regimen as quickly and efficiently as possible, but still taking the time to talk to them, keeping them informed about what the medication is going to do to their body and how they can make the most of it. And overall, I just want to help patients utilize the advancements in the pharmaceutical field to reach their health goals. So that's a big summary of everything I did. I did want to say a huge thank you to Julie Mathias. She was the pharmacy manager at the CVS I worked at, along with Sunshine and all the other pharmacy technicians who taught me everything I know about this job and have been a huge inspiration to me. And I can't wait to see where this job takes me in the future. Thank you.